for 2 weeks. They have their gym with them. They got 16 machines. They just train right
So they
there.
just bring that
They
with
bring it
them.
with them. They bring it with the
Right.
boats, you know. So they don't have to have a gym or other situation to train in. And they're just continuing to develop. What we're trying to do is keep the athlete from getting injured, which is what happens. The coaches are like, oh my God, the injuries disappeared. You know, and they're like, at one point when Harvard heavyweight men have been using this, the coach has been a long time customer. The athletic director called, the athletic trainer, Sandra Run, called them in like March. We'd started in January, March, and she's like, what's going on over there in the boathouse? She's like, what are you talking about? He's like, well, there's nobody here for rowing. What's going on? He's like, well, I don't have anybody hurt, so like, I don't need to send them over. And she's like, what? What are you talking about? So it just kind of, you know, that's just the athlete, but here it's the same thing. You're just getting quicker outcome. Really cool. So you're doing.
I mean, just even while we're in the standing position, you know, you do all the shoulder press, watching their back. You do the supination presses. You know, then we have the single arm. You know, and then you know, for someone who's restoring mobility, like frozen shoulder, you know, they could just even do the pipe, and they put their arm up here, and you just work on this. But spine control.
Yeah, so if you run like we'll run the column on your chest, it's very hard to go back and chain and move it back. So it just clarifies the workout in the extremity, so you're able to make the changes.
I don't think you guys remember Dr. Fenlon. You probably know Dr. Fenlon from Rothman, and he was obsessed with this high back chair. And if you didn't have a high back chair to do the pulley for his shoulder, he would come up and he'd yell at you. That was in the Rothman clinics with Excel back in the college. It was insane. He'd come up and take pictures of your high back chair. But he had him do the pulleys and wanted to make sure you're getting glenohumeral joint and not the thoracic.
Right.
So this is a similar thing. They could do assisted, you know, with that, or even just eccentric lowering, or even just things like this.
Yeah, so you can do like, so we do, you know, like, so I'll work those, we do the shoulder press, we'll work front, and then we go to the side, then we go behind, and then we go back. You can go backwards, and so you can teach them how to make this column in a 360-degree circle. So they're understanding how to keep that stable all the time, all directions, all planes. And the other thing too that's nice about this, and maybe Kelsey could, you know, because she's been using it more less. I've been doing this for 10, 12 years, so I'm a bad person to talk about it. But the visual feedback and the tactile feedback for the athlete, they can see what's going on, right? They can see if it's fishtailing or moving. So it's just easy to see what your resistance is doing versus you holding the weight in your hand. You can't see anything, right? So you have this other visual feel too, besides all the experiential feeling that you get, you can actually see it. So I think that helps too. So if you're doing a lunge and you got a mirror, and the athlete can see how they're shifting out or moving, and a lot of times this starts to, you know, speed that process up.
And we're going to have this in all our clinics eventually.
That's what
that's the
to
plan,
do.
you know, like it solves so many problems. You don't need all these squat machines and all this other stuff that's really
I'm going to edit that part.
irrelevant.
No, look, we talk, you know, John's obviously talking to us about productivity and you know, costs and stuff. You know, like what are we doing in our therapy sessions? I mean, when you're doing this really takes up a majority of the session. I mean, they could do some simple table things, but then you gotta get them moving. People need to learn how to take care of their bodies. And they might feel good with all the other stuff that we do here to make them feel good, the heat, the stim, all that. But when then they leave here, what are they doing outside the clinic? Playing with their grandkids, gardening, they want to go golf, they want to play tennis. They have no awareness of their bodies. So the real skill in physical therapy is teaching them how to control that. And we're just still stuck in the 90s as a profession. Anything new scares people, or they think we're just trying to sell a product. There's always fancy stuff out there. And when I put my clinic together, I told, you know, Jim Fagnani, who was my RD before, John, that I want these things. And he was like, why? And I explained to him what each purpose has. And then Bob and I talking to my strength coach, Joe, we were starting to build out this algorithm of treatment that's going to be more effective. Because we want to look at like what's going on in the clinic and what are we doing. And, you know, insurance companies are going to look at that versus these other places and say, well, we're getting better outcomes with this versus these places. Because that's what's hurting our profession. I mean, and it's not even just in this region. I have friends that live in different states and they ask me opinions on PT, and I've sent someone as to Bob. It's like the traditional low back pain build out with just these exercises. I'm like, this is what you're spending $80 copay to do?
Well,
like,
that's why companies like United Healthcare are making automated AI PT. Because you could just do like basic exercises. Anybody could teach you that. You could have a trainer in the gym and they could teach you that. So that's really partly what this does. It's taking everything from functional to experiential, and then you're transforming the patient. So those two other components aren't really there for in most cases, at least from what I've seen. And you know, again, this this goes against what's taught in schools. You know,
Yeah.
I'm going away from, like, you know, the moving back system is designed by nature to survive and expand population. That's really its goal, but it's not the best way to treat somebody, because they're doing the same skill they've been doing their whole life, and they're going to get another injury.
Yeah.
So that's what I hear when you reevaluate somebody who came back a year later and they got another back injury.
Yeah.
But all they were doing for rehab was they were doing the same movement pattern but in a different direction to cut the pain. And I'm like, yeah, but you didn't learn how to stop moving your back.
Yeah.
That's how you got injured in the first place.
Yeah. Yeah.
Right? That's the only way a spine gets hurt is when it goes out of anatomical position a bunch of times, and then
Yeah.
you're gonna get an injury.
And then it's injured.
Does that make sense? So it's not
Yeah.
like you can't use that sometimes. I'm not saying don't.
Yeah.
I don't personally, because I don't know how to work around that, but you don't want that as a lifetime pattern, because you've already been doing that.
Yeah. Yeah.
You know what I mean? So that's really what we're doing, is giving when they leave, the patient has a new map in their brain about their body. This experiential feeling process. And you're waking up muscles that I tested, I have all the data. They're weak only because the back was doing the work for them.
Right,
That's
and
the
the,
only
and the
reason
back
they're
is there to
weak.
protect
Always,
your core.
always. So that back surgeries, all those things, that's just evidence you're moving your back too much.
Yeah.
Yeah.
You don't need to move it. You're not in an emergency situation. Don't move it. Occasionally you move it, no big deal. But you can't be using it as a 24/7
Yeah.
model and expect a great outcome.
Yeah.
That's
It's
right.
never going to show up.
Yeah.
Right. And so that's really part of the process of that, is teaching these puzzle pieces. So when they're doing it, they're like, hey, wow, I never felt that before. And then just trying to, take it into their normal life.
Yeah.
Like Mike said, like the daily life stuff.
I would be drawn to this personally because I would know that I can do so many exercises for so many different body parts.
Yeah.
Fixing my
Everything.
body mechanics, coming to PT and knowing that I'm going to be doing that.
I mean,
is
and
great.
then if you are a high-powered athlete, you would super.
I am a high-powered athlete.
You would, like, for squats. I mean, there's a couple different squat corrections. We do the pull down. So they'll go down, and we cue them on where that you see a lot of them go down. They arch their back, or they completely pitch forward. We get them squatting, and this is their squat. If you put back weight on that or a goblet, they're using their backs. That's why they'll say my back hurts after squatting. So this here forces them to really, like, it's like the wall test that you do. You have them face the wall and see how low they can squat before the back arches. And with the sensor testing that we're doing, like with the Dorsa V, that's what it looks at. It looks at no more than a pitch of 30 degrees, how much that spine is moving. So as they get lower, you try to make them aware of that spine, and they can use a mirror for feedback, and then they pull in and they hold. And all of a sudden, now their hip flexors and their shins are lighting up. And then, they have the pulls there, they have the press down, so this here, and they got to stay behind the pull.
Yes, there's lots of variations
Yeah.
on what
And
you're
then they
doing
try to
with.
hold, and then they superset that. They take that and they go into the squat rack and they see, does my back feel the same with this weight? And then they know they're doing it because you see it all the time. We put the belts on, and we're not even doing weight that requires a belt. I mean, power lifters eventually have to use that, but for just people who are training, they're doing like not even 200 pounds on squats, and it's just back hurts. You have trainers telling athletes that's normal, as part of the process.
It's not normal.
I mean, it's so there's a lot of bad information out there, but if you empower the individual to understand for themselves, then they'll know, okay, this is a trainer doesn't know what they're talking about. He's
Yeah.
going someplace
So
else.
the other
like-
thing too, that what Mike's saying is, like, when we look at this force line, it's about 2 feet
Yeah.
from my spine. This requires me to activate this. Human spine is always 100 foot-pounds of force because we use it every single moment we like to move.
Yeah.
Our abs, most people's abs are, I call it like 10, 15, even athletes, maybe 20. So when they go down and squat, if this is 100 and that's 20, your back's moving all day long. Even when you're squatting down, you don't even realize you're doing these micro bends, like what I did with you.
Yeah.
All I did was change a little bit of pitch in your back, and then it stopped the back from moving. All of a sudden, the things that are supposed to light up start to light up. So when we do the squats, you're just teaching them how to start to squat downward. Now I'm getting this closer to 100. So this isn't moving when I start to put heavy weight on. Legs are never the limiting factor in anybody's squat, period.
Yeah.
It's always the spine, because you get them on a leg press, they got no problem pushing heavy weight.
Yeah.
You get the weight on them, they can't do it because their back they don't even know how to control it.
2 weeks.
So this starts to build this control. Like, you could do like multiple movements, just come down and hold it for 10 seconds. Oh, these things are like cooking tight, right? So, and the people that have the weak leg flexors, so we did that with you, Kelsey, remember? So like, I'll take them and put the column right on them, and they're like stuck. They're like, I can't go any lower. I'm like, yeah, because the muscles that are having to pull you down, you never use. The reason you can't go down is because these aren't strong enough to pull you down yet.
And you know
as
it's
you
not
get
a mobility
stronger, they're going to
issue.
start to get super strong.
Yeah, you know it's not like a range of motion issue
Not a
because if you
range
put
of
them on the
motion.
back and you flex their hip all the way up, their joint could go through the motion, but
Right,
then
so-
when, they don't have the
Yeah, well, they can
control.
squat. They can squat, but they're going to go in and
Yeah,
chain their
yeah.
back like crazy. So they can get the gross movement there. Nature it's a survival movement.
Yeah.
Nature doesn't care if you're using your back or not.
Yeah.
It's like, don't get killed in this moment by that bear that's jumping on you. Squat down and get the hell out of the way.
Yeah.
And so that system works for what it's designed to do, but it's not a good long-term
Yeah.
system.
This is
right?
also good for prevention, body mechanics.
Absolutely.
Yeah.
Just
100%. Right. So that's where
exercise.
the college teams that use it never tell anybody because it's just such a dramatic result change, and then they don't have injuries. The coach is excited because he's like, I don't have to like switch people out and sub out all these injuries.
And we
going
could
on.
see so
And
many
here's
more
a lateral
patients
shift
and
correction.
do
way
more.
quicker, right? So
Yeah.
that's another thing I talked to Mike about. Like,
So many more
my
patients.
turnover time on a patient is like a quarter of a regular therapist. I get somebody done in 3 or 4 visits and they're gone.
Really?
Not 20 or 30 visits. Yeah, because once you start to teach them what they need to feel, they're like, oh, nobody ever showed me that before. I'm like, this is how you want to move the rest of your life, right?
Yeah.
Preserve your spine.
Yeah.
And make the dumb stuff do all the work,
But
and
do you-
everybody's happy, right?
Right.
Yeah.
Otherwise, you just got this chaos that nature teaches us to survive the moment.
But what about for maintenance? Do you tell them to come back like monthly?
I mean,
to
I don't get into that
monitor their
context.
strength?
You know, that would be more what Mike would be doing. But it's generally if they're really into the machine, they're
Right.
gonna if they understand what we're doing, the experiential transformation process, they may want to buy a machine because it's easy to do. I'm not, I don't. But the hands-on process, I did with the first over 1,000 patients. I have all the data. It's all hands-on stuff.
So you have data, right?
Oh
That we
yeah,
could- Okay.
I showed Mike. I counted everything up. It's like 62 tests I do.
Okay.
I did 1,000 people.
Yeah,
That's
which
Division
is-
I athletes,
yeah.
NFL guys,
NFL Olympians.
everything.
Right.
Yeah, probably 70 or 80 national team rowers. But they all have the same errors and same injuries because they're all doing what nature taught us how to do. And so when we go back and do all the treatment methods that are out there, or Pilates, yoga, those are good exercise systems, but they're teaching you more survival movement.
Yes.
You're just doing more, so they get hurt just like anybody else, right? So the reason, it's not that you're not doing core work, it's that you're doing moving back core work. This is the opposite, 100% the opposite. It's teaching you how to stabilize your back, and then if you got to move your back in your sport, no big deal. So most of your time you're not doing it, you go play golf or tennis or throw, you might have to move your back a little bit, but you don't want to do that all the time and hope that's going to work out, because it's not going to.
Yeah.
Does that make
and
sense?
When
It
with the
does.
future of stuff with the technology, now with the sensor wearable technology, now you're getting actual analytics is how they move. Like that sensor test stuff we use in our clinic, they have a work and a functional movement type stuff too. There's actually even a marketing document that shows a mother picking up her child with proper mechanics. So it looks at where you are so you understand.
Right.
So if you're doing something, they have to reach those benchmarks, and that's what we do. We have like these milestones that the athletes have to hit because we try to get them out of PT at like 5 months at minimum.
Oh yeah, you're talking about
For like
surgery.
ACL stuff, so they have to hit these benchmarks and these movements before they progress to the next thing.
Right.
So if they don't have this, what are the things they're doing at home to correct those movements?
Right. No, so you're teaching them what to feel, and then when they go home, they're much better at doing it. So, and again, that all the data, like that's why I'm glad Mike's collected data. All the data that's done out there, every single piece of it is done on the moving back system. Everything that's out there, everything. So like when I look at that, I'm like, that's muddled data. Like we're starting to collect data when you're actually teaching an athlete not to move their back. It's different data. It's a totally different experiment. Does that make sense? So like anything that's out there, I'm like, yeah, okay, but the athlete didn't even know that they were doing this moving back system because that's what nature teaches every human being on the planet. We all do it until you run into people like us. Otherwise, you don't even know this other way to move exists. And so then you're not aware of what you could be. That's why you get these huge jumps, even in the college teams. Just giant jumps in performance in 8 weeks. They get, and then then they reach a plateau. But we're just trying to move them. Like so, for Mike's patients, I don't want to see the ACL athlete come back in. And I would guess most of those ACL injuries happen because the athlete didn't know they were using the moving back system to move, and these muscles were weak. Quads and glutes were strong. Everything else sucked.
We have them doing like 2 sets of 10 of bodyweight stuff, and even without BFR, if they're just doing a set or something, and they're shaking. And I'm like, how do you do 3-hour practices? Because again, they're surviving.
They're just surviving, and their
diminishing
back's
returns.
tight and stiff,
Yeah.
and so they get through it, and you think that that's the context of practice. Oh, well, everybody's back hurts and sore. I'm like, well, it should be, right? I mean, and that's just
And then we want to bring on Dr. Dodson. He said he'd come on our podcast to talk, but we want to see he's on the end of the spectrum working with the Eagles, but he also works with high school athletes. What is it that takes a 16-year-old kid to tear the same ligament that a pro athlete? You know, you saw Kyler Murray tear his ACL on Monday Night Football. What happened there? And you look at the angles and the forces, and those are things they're studying, but what are the other factors that go into that? The movement control, the sleep, the nutrition, hydration. What are things that people are doing? You know, and this is more for the athletic population, or if you have an active adult who wants to do stuff and they want to go golf and play tennis. Well, what are the other things you're doing to take care of yourself because you keep getting these injuries? So it's a huge education process of understanding that, and that's where the power of PT comes in, because we're leaving so much on the table, you know, and people think we just come in, and that's why, again, insurance companies think they give a DVD of just do these exercises and be good. So that's all they think we do. Is, oh, here's some 6 to 8 exercises and that's it. And it's a lot more than that. You have a doctorate degree, you know, like start showing like what's working.
No, but I think,
you know?
so like the way Mike, that reason we gravitate to each other, because he's got the same open mind. A lot of people don't. I'm not going to say
Mike's
good or
very,
bad.
very open-minded.
Right, no, so that's why I knew that, so that's why I moved towards him and gave him the equipment. I didn't even charge, like, just use it.
But I've also been doing it too for 12 years too, and I've been in a lot of different clinics, and I've seen a lot of people move. I've tried a lot of different things. I've taken a lot of continuing ed courses. I'm also still a competitive athlete. So I see athletes that are really good and I compete against them. I see the different genetic dispositions, the body types, and you start seeing the same patterns. And that's the hard thing too, is some of like the younger population coming out into the profession. You know, they want to go straight on Instagram and see stuff, and we have to deal with that too with, you know, some of the young trainers and PTs we deal with, because they see something and they just think that, well, he says he deals with high-level sprinters. First of all, describe to me high level. It's a free country, you can say whatever you want. Or they read a book. Anybody could write a book. Was it peer-reviewed? And, you know, where are they getting this from? So that's kind of the culture we're in, that everything is out there. You have to cipher through what's legit, you know. So, I mean, that's also the other thing, too, because patients will come in and say, well, I saw this on Google, or I saw this on Instagram, I saw this on Facebook, and you have to have the tools to show them what's right and wrong, or, hey, that's good, but not appropriate for now, or this is what they're striving for, it's not appropriate for you. I mean, all it takes is like one NFL guy to be doing squats on a Bosu. Now everyone wants to squat on a Bosu, and I'm like, you know? Yeah. So, you know, so there's all those shiny object things that Bob calls it out there. You know, it looks cool, but is it working?
The thing is, if you don't have fundamental control in your body, you don't know what that is, all the other stuff is, you're way past where you are, and you're going to get hurt. Yeah. That's just what happens, right? And it's not bad for the business in itself, but that's not really what we're trying to have people not get hurt again. Yeah. That's always my goal. Like, never come back to PT. Yeah. Learn how to move and just enjoy the rest of your life and do what you should be doing. Yeah. Now, don't be distracted by pain that could easily go away if you change your operating system. Yeah. If you keep doing this, you're going to get more injuries and show up all different places, right? Yeah. This, like, I don't care.
I mean, I tell the high school athletes that the PT, I mean, this is the boring stuff. But you need the foundation, because if you don't have the foundation on a good house, guess what? It's going to crumble with the slightest crack. Yeah. It's the same thing. You could have all this stuff in a fancy car, engine and all this, but if your alignment's off, you're not going very far.
It's like, you know? So like what Mike's doing with the testing equipment, I think is very valuable when you have this fundamental foundation. I think the really expensive equipment with the athletes still using the moving mech system is a waste of money and time. You're really not going to get, you're just not going to get, it's just going to be like...
Well, you see the deficits, but then what are you doing about it? Okay, so we see the numbers are not where they are, how do I correct that? So the testing is good because it shows you, but you need the skill to fix it.
How do you correct it? How do you change it? That's really how I started this business. I took Greg Cook's course in 1997. First I took Shirley Sarman's courses. Then I took this, and I'm like, but wait a minute. There's still, how do you correct it? That's good testing, but how do you change that?
What do we do with that?
You know?
Well, that's why the SFMA higher level courses have corrective options, but Greg Cook always says, be creative. If you understand the concept, you could be creative with it, but you have to understand the concept,
the thing is,
you know?
And I haven't taken any of his courses, but I don't think they're teaching this. They don't really understand how to get this new map in somebody's brain. They can do the right exercise, but it's the wrong body application. They're doing the same exercise and their back's helping. It's not that it's not an exercise, and it's not that it can't be challenging, but the problem is you're just reinforcing the same old system, and something else is going to come up. This just gets rid of, you start to build this new map, you start to get rid of all that. I call it residue. The residue starts to go away, and then you're not going to get hurt.
Yeah.
You know.
Thank you, Bob.
Yep.
That's awesome.
So speaking of like that lateral stuff, this is really good for older population. Here, and they just do a side step, and then they come back. When they get advanced, they step here, and then they got to lift their foot up, and they come back to single leg, and they're like this.
Yeah.
This is a great lateral movement control. Then, you know, you go into lateral lunges. You know, you could do the side stepping here so they can't move their back and look like a penguin.
Yeah.
You see that all the time.
Yeah, so we lock the hands in to get their spine so it doesn't move. And then they're like, wow, that's a lot of work. Instead of, you know, people got those bands around their legs and they're doing this.
Yeah.
I'm like, how's your back feel? Because mine's killing me looking at you.
And all you do is just prop them up against a wall like that,
Yeah.
you know, and then again, for some of the older population, just doing cross chops, just like this, making sure they're not twisting their spine, you know, and then you could do things where they gotta take something down and kind of come across. I mean, this is a harder band.
Yeah, for stretching, you can just do like, you know, so again, everything you're doing, you're just trying to get them to start to understand how their back's not moving. Now you're making the dumb stuff, the legs doing all the mobility and strength.
Yeah.
All the mobility and strength has to come back and the back's not
And then you give them the standing kicks, you know, the side steps, because then they know what to feel like, and then that's the build out for home, or that's some of the therapeutic exercise section, where this is all the neuro re-ed and the manual and the education. So that's where the units start coming out, because therapists are finding a hard time too. Like, well, I can only build 4 units. Like, well, what are you doing? I mean, how many table stretches can you do?
Right.
You know, and then it's like, that's why. But if you're actually really spending the time with the patient and the education and answering the questions, you fill up an hour very easily.
Yeah.
A lot of our patients are tapping out. I mean, they're like, when are we done?
Yeah.
You know? So, but I'm like, you're paying money and time to come here. I'm not going to waste your time. If you want to go for easy stuff. I mean, I had a woman who was in another facility. She's paying $80 to scrunch a towel with her toes. I'm like, it's an embarrassment, and that's what she thinks what PT is. I'm like, you can't even make this up. So, you know, that's the stuff that's out there. But what was out there? I want to show you the hip hinge. I love this technique for teaching lifting from the floor. So this shows them where their spine has to be, and you'll see a lot of people, they get stuck, they don't even know what to do. I'm like, go down and reach for the peg, because they want to just do this.
Yeah.
So it teaches them to get into their legs, and you'll see how weak a lot of these even older people are. They want to do gardening, and they want to like clean out their garage, and then you wonder why their backs are blown up, because they get here, they have no power. I'm like, lift it up, and they're like, oh my God. And then that's it, like one, and they're done.
Yeah.
And then I'm like, all right, how do you put it back down? And then they have to get their hips behind.
Yeah, 'cause it's forcing you to it's forcing you to not bend the back over. Because they'll want to do this, chain the back, and then
So there's a whole hip hinge deadlift correction.
Right.
And then you translate it to like a dowel or any bands, and then they practice lifting from a stool. And it's this whole sequence, and that's what your whole visit could be spent on. Little manual, whatever they have to do, you know, maybe some other stuff like some bridges and things to warm up, whatever you want to do. Like we build it out, like if they're doing bilateral stuff, they might have some bilateral warm-up stuff, or there's single leg patterns. And then the session focuses on, we're doing deadlifts today. And then for some of our athletic population, they might do some of those prerequisites before they get into impact control. Double leg jumping, single leg stuff, because they're going through the sequence in this process, and it creates these patterns for them. And then the strength coach section, when they're done there, he starts creating workout routines. But he can't create a workout routine and have, you know, squats, assault bike, things like this, if they don't know how to do these things. So that's why we partnered up, because you teach them these patterns so then they can do the workout programs. So otherwise they're just going to a workout and just compensate.
So I think this is great for our older population as well, not only our athletes. This is great for older populations.
Yeah, well, we want to try to promote some of the older individuals to get onto a fitness program.
Absolutely.
So at our clinic being in a fitness facility, they could see the other side. It motivates them to finish their course of PT, because then they're going to get there sooner, and then they can start strength training and doing it. And sometimes the trainers can't do anything with them, because if they're not doing it right, it's like you need a foundation cleanup.
I always say to the Medicare, I'm close to that age, believe it or not.
Are
I
you?
always say to them, I'm like, there's no ARP discount on gravity. You can't, you cannot, there's no way around that. So you want to have a good life the rest of your life. You can't be just doing nothing. You know, so these simple movements can just totally change the way they use their body for the rest of their life. So my goal is preserve this and make dumb stuff do all the moving work. And everybody's happy, right?
Yeah.
Thank you, Bob.
Yeah.
Thank you, Mike.
Yeah. Thanks for having us here. I know this is like there's a lot to cover.
Thank you,
And
Kelsey,
so,
Nicole.
But this is just a start to kind of open your eyes to a little bit.
Yeah,
This
we're going
is
to try
definitely
getting like
great.
an intro course going, kind of.